If you suffer from tinnitus and you have a hearing loss, there's a 60% chance that hearing aids can provide some tinnitus relief. Watch this video until the end to learn exactly how to make hearing aids work well for your tinnitus. This is Pure Tinnitus. Hey, my name is Dr. Ben. I'm an audiologist and tinnitus specialist in California. So if you have a hearing loss and you have bothersome tinnitus, I really think you should give hearing aids a try. There was a survey that found that 60% of individuals found relief with their tinnitus from wearing hearing aids. The benefit that they found was that when they were wearing their hearing aids during the day, the tinnitus was less noticeable and less bothersome. The benefit from hearing aids comes from audibility. What that means is that when you have a hearing loss, your auditory brain has less access to the auditory sounds in your environment. Usually it's with soft, high-pitched sounds. The auditory brain doesn't have the input from the soft, high-pitched sounds, so it creates this phantom high-pitched tinnitus. When you stimulate your auditory brain with sound, that typically takes the perception of tinnitus and lowers it or makes it softer. What a hearing aid does is it takes the sound that your ear is not processing and it amplifies it so that you can hear the soft sounds you've been missing. Now, for your ears, this provides constant access to more sound, and that typically means your tinnitus is easier to live with. When you're wearing the hearing aids, your tinnitus is usually lowered. As explained earlier, most people got tinnitus relief from wearing hearing aids during the day. When you're wearing the hearing aids, there's a standard feature which would be ear level relaxing sounds. Now, these can be programmed in the devices so that when you click a button, you'll hear some soft white noise like shh, or it can be a different setting that can be more like ocean wave noise, and that might sound like shh. There's other kinds of nature sounds that can also be beneficial and make your tinnitus less bothersome when you're wearing the hearing aids. I also strongly recommend that you get hearing aids that would connect to a Bluetooth phone, like a smartphone, because then you can stream any sort of audio input you like straight into your hearing aids. So if it was me, I would use an app like Spotify, and I would find the best nature sounds, and I would be streaming them through my ears at a soft level during my day when I'm otherwise bothered by my tinnitus in quiet places, and that would be the most customized individual option to have hearing aids through Bluetooth significantly improve your tinnitus during the day. It's worth noting that the hearing aids are not designed to improve your tinnitus at night. At night, you don't wear the hearing aids, you take them off to go to sleep. So once you take your hearing aids off, your tinnitus is gonna seem pretty loud because there's that difference in comparison. Therefore, we also emphasize having a good strategy to help you sleep at night with your tinnitus. We made a whole video on this. You can check that out in the information below. This is our Pure Tinnitus channel. Press that red subscribe button so you can get our new video coming out every single week. So maybe you're wondering, where do I get hearing aids? It's worth noting that hearing aids have a trial period where it's usually 30 or 45 days where you can try them out, and then you can get all your money back if you don't like them, if they don't meet your needs. So I strongly recommend that you at least try hearing aids if you think you have a hearing loss and you also have bothersome tinnitus. The most qualified professionals to treat hearing loss are doctors of audiology. So I recommend first that you consider seeing an audiologist. The reason I recommend audiologists first is because they're most likely to include a system called real ear measures. Using real ear measures involves putting a small microphone tube in your ear canal, putting the hearing aid over the top of it, sending some calibrated speech signals into the hearing aid, and then recording how well the hearing aid is producing the sound into your hearing system. Through that test, the audiologist matches the hearing aid to the prescription, which is recommended based on your hearing test, your hearing loss. Audiologists are the most likely to use real ear measures to verify your hearing aid is working, but you can also find hearing instrument specialists who do this procedure as well. Some places like Costco are also known to do real ear measures. Regardless of where you go and which provider you see, you need to make sure they're using real ear measures. My colleague Dr. Cliff, who's an audiologist, made a whole video about real ear measures. I'll include that in the info below. You can check out his channel. Hearing aids can help with long-term habituation to tinnitus, and that means that over many months, your auditory system is getting a lot of access to sound where previously it didn't hear with the hearing loss. So having that sound into your brain can help with habituation. But hearing aids by themselves are not going to habituate your tinnitus so much. The core of tinnitus habituation is learning the relationship between your auditory brain, your emotional brain, the limbic system, and then your autonomic nervous system. If you're wondering about how exactly you can habituate to tinnitus and the best way to do that, there's more videos we have on this channel. You can find them below in our related videos. Give us a thumbs up for this video, because if you don't, YouTube doesn't recommend our video to anyone else. We have a free newsletter for Pure Tinnitus. You can find that in the info below. If you're not already, press that red subscribe button so you don't miss our tinnitus education video coming out every single week. And tap that notification bell so YouTube lets you know when it comes out. My name is Dr. Ben. This is Pure Tinnitus. And remember to take your journey one step at a time.